Thank you so much. So we just finished the session a few minutes ago, so let me summarize. The session was on cutting health risks along the value chain. So there are 6 key points that I want to bring up as a result of this discussion. The first one is that clearly there is a need of a chain approach, and we need to look to all the different points of the value chain. Why? Because it could be that we can resolve the problem, the health problem or the safety problem, in the soils, but later on the problem could appear in the storage. So if we press a button and resolve one problem, it could be that another button will come up and another problem at a different point in the value chain. That's why the whole chain approach is central to look into health risks and how we produce and how we move from production to consumers. The second point is that food safety shouldn't be only an issue for exports. We clearly know that there is a missing market for information. There is a market failure. The information on the attributes of the products and the standards and the risks that you upfront when you eat those products are not clear. And there is more investment needed to be able to provide that information. But certification for exports is not the only solution. We also need to care about local markets and local consumers. So food safety shouldn't just be an issue for export markets, it should also be an issue for local markets. And for sure, food safety will bring new attributes, and those new attributes to the product also are linked to incentives and to price incentives. But we shouldn't assume that local consumers won't be willing to pay when they know what are the risks they are facing when they eat the food they are eating. So that's very important to understand and to know, and there was a very nice example of cellular phones. Nobody will have expected that people will buy prepaid phones, which are the most expensive compared to postpaid phones, and the poorest are the ones using them. So we need to be very careful that information is important, and the knowledge of the attributes of the product could also create a bigger willingness to pay for local consumers. But we need to find a minimum safety requirement and also not over-exercise the certification requirements. The third point is it's important to identify the risks. It's important to do a risk assessment analysis, and also it's important to identify the cost and the mechanisms through which we can resolve the risks. One solution won't fit all. Farmers are at different sizes and at different levels, and the risk could be different across them and across the chain. So it's very important to have a clear risk assessment and a clear cost-effectiveness analysis of the different possible solutions available to resolve those problems. We shouldn't expect small farmers to have the same solutions than medium and large farmers. The point number 4 was that there is a triangulation between production, communities, and health. And this triangulation is complex, it's not easy, as everything we have been discussing in the last days. Also, it's unpredictable. The idea that I solve the problem in the soil, but the problem then could appear in the storage. And for sure, to be able to analyze this triangulation, we need to bring interdisciplinarity. It's not only an issue of economists, of nutritionists, it's also an issue of science, of scientists, both in the academia, in the NGOs, in the private sector, in the public sector. So this triangulation brings all the different sectors together, and we need to bring this multidisciplinarity if we want to find the link between health risks along the value chain. The 5th point is the smallholder paradox. We knew that the smallholders are more productive, and that was the benefit of the Green Revolution. But today, with the modern value chain, the issues are not scale neutral like they were with the Green Revolution. So to be able to link to the value chain, farmers have to assume a minimum fixed cost. Those are the costs of certifications, those are the costs of storage and standards. And those fixed costs cannot be afforded by the farmers, small farmers by themselves. And that's where collective action, farmer associations, and vertical coordination mechanisms like contract farming could play a crucial role. There was a nice example of Maha grapes and how they coordinate across farmers to be able to resolve that problem. So this lack of scale neutrality today to link to the new and the modern value chain is very important, and we need to focus on that, because it's not only an issue of productivity, it's also an issue to cover those minimum costs to be able to participate in the modern value chain. And the last point is that clearly we need more knowledge on the links between the health risks and the human health. There is a lot of talk about the effects that a specific risk on a plant or on a product will have over humans, but there is very little solid evidence that could argue causality. So there is a significant need for doing investments in being able to create those links so that we can really identify causality and be able to resolve them if necessary. Thank you so much.